Good afternoon. This is Dr. Jerome Paulson. I am the Director of the Mid-Atlantic Center for Children's Health and the Environment, and I would like to welcome you to this webinar that is jointly sponsored by the Mid-Atlantic Center and the National Nursing Centers Consortium. Funding for this comes in part from the Pennsylvania Department of Health and the Clinical Directors Network. The Pediatric Environmental Health Specialty Units are indirectly funded by the Agency for Toxic Substances and Disease Registry and the Environmental Protection Agency. They do not review they did not review this presentation, and there's nothing in this presentation that should be construed as ATSDR or EPA policy. We're going to think about environmental health hazards in the home and hone in particularly on lead and asthma, and try and provide the listeners with information about screening and identifying and then managing these conditions. And we'll focus some specific information on individuals based in southeastern Pennsylvania. So I want you to look at the two pictures on this slide, the home on the left and the home on the right. And I think it would be relatively easy for anyone to imagine some environmental health hazards that might be associated with the building on the left. This is an older building. Perhaps there's lead. Looks like there's a lot of trash around the building. Maybe there are rodents or cockroaches, which would exacerbate problems for individuals who have asthma in the home. But even the home pictured on the right-hand side of the image may have some environmental health problems. Radon, if pesticides or fertilizers are used on the lawn or inside the house. So it's important not to judge the proverbial book by its cover, but rather to look at the home in detail and find out which environmental health hazards may be present, and then to try and deal with them in a comprehensive sort of a way, such that if one finds a problem with lead, don't just deal with that, but if there's maybe coexisting problems with excess moisture or radon or something else, try and identify everything and deal with everything all at once. There are a lot of
just like you.
There are a lot of characteristics of a healthy building. Some of these vary a little bit depending upon the types of building. In particular, it's important to have good communication among the individuals who are using the building, particularly if it's a school, a multifamily dwelling, if it's a business. Hopefully, if it's a single-family dwelling, they are talking to one another about what's going on there. Buildings need to be dry. They need to be adequately ventilated, not too much and not too little. There needs to be control of biological exposures like mold, bacteria, dust mites, etc., and chemical exposures, which may come from cleaning products or dry cleaning, clothes that have been dry cleaned that are brought into the home. The place needs to be kept clean to control those biological exposures. In particular, attention needs to be paid to injury prevention, maintaining a comfortable temperature, having enough space for everybody. As it relates to kids and adults, there needs to be an appropriate degree of quiet so people can study, people can sleep at night, get the rest that they need so that they can function, pay attention, do their schoolwork, drive safely, etc. the next day. And of course, all of this stuff needs to be maintained on an ongoing basis. Now, there's some slightly different issues that pertain to buildings that are being proposed to be built versus buildings that already have been built. With a new building, you have to decide where, in fact, it's going to be built. How close is it going to be to the road? Is it built on a former brownfield site? What was that property used for in the past? Maybe it was a farm or an orchard where there are a lot of leftover pesticides from years of previous use. What's going to be used to actually build the building? Will all of the waste be removed from the building site and handled in an appropriate fashion? And is the building designed to meet some of those criteria that we mentioned in the previous slide, for example, lighting and ventilation? With existing buildings, what's used for maintenance and renovation and cleaning? What kinds of cleaning products are used? If maintenance or renovation is done, are those areas appropriately isolated so that people do not get exposed to potential contaminants during the renovation, etc.? And we worry about kids because they spend so darn much time at home or in home-like settings if we're talking about home-based child care settings. So infants can spend up to 20 hours a day in their home, and older kids, because they go out to school, can spend up to 15 hours a day at home. This obviously includes sleeping time. And so this gives many hours during which exposures that could impact on could impact on children's health to occur. Now, when we think about environmental health hazards, I think most of us think first about chemicals. And while that's an important topic, that does not subsume everything that we need to consider. In addition, we also have to recognize that there are some naturally occurring chemicals that can be in the home that, in spite of the fact that they are natural, are in fact dangerous. The most prominent of those is radon. And then if we look at chemicals that might be in cleaning supplies, cosmetics that might come into the house on clothing that have been dry cleaned. These are other issues. Certainly, tobacco smoke is secondary or tertiary exposure for the kids, and then for the adolescents, if they unfortunately start to smoke, there's primary exposure as well. In an old building, if the paint is deteriorating and contains lead. But another thing to think about is lead can be a problem even in old buildings that are well maintained. Usually, if the paint is intact, that doesn't create a problem. But think about the family that's trying to do-it-yourself renovation, and they've got an 80 or 90-year-old home, and there's lead paint maybe that's 2 or 3 layers down on the walls or the windowsills, and they're not aware of the kind of precautions that need to be taken to do that renovation in a lead-safe manner. And then the adults may become lead poisoned. If there are children already in the home, they may become lead poisoned. Pets may become lead poisoned. And in particular, if the mom is pregnant when she's doing this do-it-yourself project, then her fetus in utero may become lead poisoned as well. And for any home that has an appliance or an automobile that burns anything, carbon monoxide can be a problem. But then other issues that influence environmental quality, or whatever the heating, ventilating, and air conditioning system is. Has there been dampness that has allowed the growth of mold or bacteria or the deterioration of building materials? Are there pests, cockroaches, and rodents in particular as they relate to asthma? Is there noise, not only perhaps from neighbors in multifamily dwellings, but if buildings, high-rise apartment buildings, homes, schools, are built near highways, near airports, train stations, subway tracks, train tracks, any of those kinds of things can create noise, disrupt sleep, interfere with children studying when they come home from school. Is the building accessible to individuals who have mobility or other kinds of problems, and what injury prevention activities have been undertaken in the home either during the time it's been built or during renovation or on a daily basis to prevent falls and burns and other kinds of injuries that can occur in a house, an apartment. When I say home, I'm being all-inclusive. And then there clearly are other factors in the home environment that impact on children's health, and while these are extremely important, I'm not going to spend any additional time on them today other than to mention issues of parental mental health, food insecurity, domestic violence, and firearms that may be in the home. These all contribute to the environment that the child grows up in the home. Again, it can be an apartment building, it can be a single-family home, multifamily dwelling, and these are all important factors, but we're not going to focus on them today. So let's talk in a little more detail about lead. This is sort of the best known of the pediatric environmental health problems. This is something that we should not be talking about in the 21st century. The problem with lead in home settings or other kinds of settings has been known literally for over 1,000 years, and we've known it very well in contemporary times for well over 100 years. And as I think many people on the call recognize, lead paint was commonly used for interior and exterior painting in many homes in the United States. Particularly, it was banned for interior use in 1978, so that's why that date is important. And particularly in homes and apartments built before 1951, there's a very high likelihood that unless that was totally renovated at some point in time, that there's lead paint somewhere in that building. It's estimated that even today there are at least 4 million households that have children living in them where the kids are being exposed to lead, and about 500,000 kids with blood lead levels over 5 micrograms per deciliter, which the CDC now sets as the reference level. Now, this is very different than what the CDC used to say of 10 micrograms as an action level or level of concern. The CDC recognizes very well, as does almost everybody else, that there's no safe level of lead. The average blood lead level in the United States from NHANES in the last couple of years has been around 2 micrograms per deciliter of blood. And so the 5 represents a level of exposure that is significantly greater than the average child in the United States, and that's why the CDC chose 5 as the reference level. And if we did a good job, a better job of screening buildings in addition to screening kids, because we have to continue the screening of children until we do a good job of screening buildings. But if we screened buildings, identified those that present a risk to children, we could finally actually eliminate almost all, not all, but almost all childhood lead poisoning. Most of the poisoning today still does come from old paint, but as lead paint becomes less common, as old buildings are torn down, new buildings are constructed, and things like that, things that we used to talk about in a category of other become more common. And these can be things like lead in cosmetics that have come in from another country, lead in homeopathic medications that have come in from another country, lead in spices that have been imported from another country. And many of these situations are not cosmetics or spices that have been bought at stores, but rather family members in whatever the old country is for the particular family that you're dealing with, having sent them homeopathic remedies or spices that they like to use and things like that, and the standards for the manufacturer are not comparable to those in the United States, and the children, sometimes the adults as well, become lead poisoned. As I mentioned, there's no safe level of lead. The problems that are associated with the blood lead levels that many children still encounter today are small losses in IQ, increased risk of attention deficit disorder or other attention problems, poor academic performance, and as the kids get older, behavior problems. And I think that for the individual children, the attention problems, the behavior problems have a greater impact than the small loss of IQ. But on a national basis, the small loss of IQ cumulatively is still very important. And so for all these reasons, we need to keep working on this problem. The IQ loss is about 4 IQ points for blood lead levels between 2.4 and 10, but a shift of just 5 IQ points in the whole population quadruples the risk of individuals having IQs below 80 and decreases the number of people with very high IQs. The Pediatric Environmental Health Specialty Units, of which the Mid-Atlantic Center is one, got together after the CDC came out with this establishment of 5 micrograms per deciliter as a reference level, and tried to create some recommendations that primary care providers can use on a daily basis. And you can find all of this information at www.PEHSU.net, and you're welcome to download it, reproduce it, hand it out to your families. It's not copyright protected, so we welcome anybody to use it. But let me just go over some of these set of recommendations. So for kids who are coming back with blood lead levels less than the reference level, the families need to understand that this is a low exposure, unlikely to have demonstrable impact on the child, but the child should be retested depending upon the age at which the original testing is done, and finding out about the age of the house, and then giving people appropriate guidance about the home and if they may be at risk for using some of these medications or spices, etc., to inform them about that. For kids in the 5 to 14 range, they need a venous level in about 1 to 3 months, particularly if the original test result was not a venous level. And if their repeat level is not going up, then they can be checked on about an every 3-month level. It's certainly worthwhile to find out about other kids living in the same home or building with the child who you're seeing, and getting those kids evaluated if they are in an age range where they might be at risk from putting things in their mouth, or getting the whole family evaluated, including the adults, if spices or pottery or other things that might expose the whole family are the potential source of exposure in the individual child. I think everybody's aware that lead absorption is influenced by the presence of calcium and iron in the diet, and so kids in this range of 5 to 14 micrograms per deciliter should be on a high iron and high calcium diet, and it's probably reasonable to check their iron levels and their blood counts and things like that. And these kids should be flagged for closer follow-up related to development, and then when they get into school, more importantly, academic difficulties, than children who have blood levels lower than the reference value. It's unlikely that these kids are going to manifest their learning problems until they get into school, but it's worth close follow-up. And then for kids with blood levels above 15, you basically do the same thing, but then depending upon what else you find out in your history, it may or may not be indicated to do an abdominal X-ray, and if that is positive and shows evidence of radio-opaque material in the GI tract, then using cathartics to clean out the GI tract, or if it's a foreign body that might need to be removed surgically, et cetera. The CDC does not recommend chelation for children whose blood levels are under 45, so kids in the 15 to 44 age range probably don't need chelation. Although if you've got somebody in the 30s and 40s and you're following them and the level's going up very quickly, you may want to consider, number one, getting them out of wherever it is they're living and into a lead-safe place, and maybe chelating them a little early. But that should be done in consultation with a local lead expert or the pediatric environmental health specialty unit in your specific region. And for those of you who are in Region 3, Pennsylvania, Delaware, Maryland, Virginia, West Virginia, and the District of Columbia, that pediatric environmental health specialty unit is the Mid-Atlantic Center for Children's Health and the Environment, and we're happy to try and help you. So let me turn now to probably the most common chronic disease of children, asthma. And there are over 7 million kids in the U.S. who have been diagnosed with asthma. And asthma costs the school systems in this country and the children and the families 10.5 million missed school days per year. So obviously kids who aren't in school can't learn, but kids who aren't in school need somebody to supervise them and give them their medicine, and that often means that parents need to stay home, so there's a loss of income along with the increased expense if that kid gets sick enough to need to go to the office, the medical office, or the hospital. In the general population in the U.S., about 10% of kids have asthma, but in some inner city areas, inner city neighborhoods in Harlem, certainly inner city neighborhoods here in Washington, D.C., where I work, and I think if people look hard enough, they'll find in many inner city neighborhoods prevalence rates of asthma up to 25% of children in some of the schools or some of the neighborhoods. We don't know what causes asthma, but clearly in both indoor and outdoor pollution can make it worse. Kids in urban settings are at increased risk for the development of asthma, and this may or may not have something to do with ozone and other pollutants that they are exposed to. It is clear that kids who spend a lot of time outdoors in communities with very high ozone levels about triple their risk of de novo development of asthma. But whether ozone is the only cause for this urban-rural difference isn't known. And then in terms of deaths from asthma, those are more likely to occur among minority racial groups and individuals of low income, so African Americans, Puerto Ricans, and again, individuals with low income. There was some increase in the asthma prevalence rate between the 1980s and the 1990s, and then the rates, with the exception of that for a lifetime asthma diagnosis, as you can see in this graph on the right-hand side of your screen, the rates seem to have plateaued between the 1990s and through the first decade of the 21st century. I'm not going to spend any significant time on the non-environmental management of asthma. You can look at the National Heart, Lung, and Blood publications, the expert panel report from the National Asthma Education and Prevention Program. These are the best guidelines that are out there, and they will talk to you and teach you about medications and other factors related to management, but I want to focus on the home and the environment within the home. I just will say that, of course, this report focuses on the need for the widespread use of inhaled corticosteroids in children with chronic asthma, a written asthma action plan so that parents, teachers, grandparents, or other care providers all are working from the same set of recommendations. Intermittent assessments of asthma severity and modification in the use of controller medications on the basis of that assessment. And that can only be done when kids are seen when they are otherwise, quote, well, unquote. We need to convince families that asthma is a chronic disease. The kids need to come in not just when they're sick, but also when they're well, so that their providers have time to work with them on how to maintain the good peak flow, the lack of waking up at night, the lack of cough, the ability to run, and all of those things that indicate good control. So asthma triggers include molds, pests like cockroaches and rodents, or the antigens from them. Sometimes chemicals that are included in cleaning supplies or even perfume can exacerbate asthma. Tobacco smoke's a major problem, dust mites, pets, and others. And I'm going to focus primarily on the mold, the tobacco smoke, and the dust. So as you know, environmental tobacco smoke or secondhand smoke consists of over 4,000 chemicals, and more than 250 of them are known toxicants, including some of which are carcinogens. Exposure of the pregnant mom to environmental tobacco smoke changes fetal blood flow and other aspects of the placental interchange between mom and child. This leads to chronic fetal hypoxemia, and the nicotine, which does cross the placenta, may have an effect on neurotransmitters, which certainly has been demonstrated in animal models. Once the kids are born, so this in utero exposure then leads to preterm birth and small for gestational age babies. And then once the children are born, they are at increased risk of having sudden infant death syndrome. For moms who smoke both during and after pregnancy, There are increased risks for asthma in the kids, otitis media, upper respiratory infection, and long-term decreased pulmonary function measurements, even if the kids do not have overt symptoms such as asthma. And interestingly enough, with environmental tobacco smoke containing neurotoxicants, it's not particularly surprising that low-dose long-term exposure of this neurotoxicant, as with long-term low-dose exposure to lead, with some of the pesticides that are neurotoxicants and other chemicals, is associated with decreased attention, increased behavior problems, small decreases in IQ. So neurotoxicants impacting on the brain in utero and in early childhood seem to have similar outcomes. And then the third-hand smoke, that residual particulate matter that is on countertops, in the hair, on the clothing of individuals who smoke or others who are in the environment with individuals who smoke, can also in and of themselves cause problems, particularly kids. We know about kids and playing on the floor and exposure to lead, but kids and playing on the floor means that they're exposed to everything that may be in the dust on the floor, even if lead's not present or in addition to lead when it is present. And this particulate matter certainly can precipitate out onto the floor. The kids can inhale it as they stir up the dust, and it can induce airway inflammation, which can exacerbate asthma. When families are in single-family homes, they can control what goes on inside their home. But when families are in multifamily dwellings, they may be able to control what goes on in their unit, but they may have no control over what goes on in the common areas of the building or in other units. And particularly buildings that were built earlier than the last decade or two have a lot of interconnections in terms of the air handling systems, and smoke and secondhand smoke and third-hand smoke can move from unit to unit or from hallways and lobbies into units. And it's important to advocate for kids, encourage landlords to have non-smoking policies. In Alexandria, Virginia, where I happen to live, there's been an effort actually to pass some laws to limit smoking, ban smoking really, in multifamily dwellings. And for those of you who have either a medical legal partnership where you practice or a local legal aid group that works on health issues, working with them to affect changes in dwellings where kids live can be, they can be very useful allies. So I'm going to give Rebecca a chance to add some information in a moment, but I just want to summarize a little bit about what I've said. The house, again, whether it's a multifamily house, a single-family house, influences health of everybody in that unit, in that dwelling, whether those individuals have no pre-existing condition, their lungs are affected by environmental tobacco smoke, by chemicals in the cleaning products. Their mucous membranes in terms of their eyes and nose can be similarly affected. So there are a lot of things in the home that influence health. And again, whether it's somebody who has a pre-existing condition like asthma or somebody who has no identified health problem. And as I mentioned, some of the issues to think about are different for new housing, the creation of new housing versus existing housing. And I think for in many of the areas where the National Nursing Center Consortium works, I think, one of the issues is going to be where new low-income or Section 8 housing gets built, and is it being built in areas that wouldn't be acceptable for other individuals in that community, and if that's the case, why is it acceptable for these low-income families? As health professionals, we may think that we don't know enough about building science, and we realistically probably don't, but we can work with building professionals, industrial hygienists, departments of housing or departments of environment or departments of health within the communities in which we live to try and make sure that the housing is safe for the individuals who live there, both in terms of not having lead, not having mold, not having environmental tobacco smoke, et cetera. And that makes the last point that I want to make right now in terms of when you're involved with discussions of health and housing issues, as some of you I'm sure have experienced the same thing that I've experienced. Mom comes in with a child who has asthma, flips open or opens up her phone and says, take a look at this picture of this wall, the hot water heater in the apartment above me leaked, and now I've got all this mold, and now my kid who used to need her inhaler only once every 3 or 4 weeks is needing her inhaler 3 or 4 times a day. What's going on? Also think about other health issues in that home. Is there vermin? Could there be lead that was also disturbed, lead-based paint that was disturbed by that water that led to the creation of the mold, et cetera. And so now I'll turn this over to Rachel Greenberg, and she'll take it from here. Rachel?
Thank you so much, Dr. Paulson. That was fantastic information about how the home can impact pediatric health. Just to introduce myself again, I'm Rachel Greenberg, and I run the Southeastern Pennsylvania Lead and Healthy Homes program for the National Nursing Centers Consortium, and our program is funded by the Pennsylvania Department of Health. And I'd just like to take a moment to share with you some information specific to Southeastern Pennsylvania, particularly the resources that our Lead and Healthy Homes program can offer to help combat the home health hazards. So our program strongly agrees that the home can have a huge impact on the health of its inhabitants, and Southeastern Pennsylvania faces some ongoing challenges in this area, particularly with regards to decreasing lead poisoning and improving asthma treatment. So to provide you with a sense of the great need in the region, which is not limited at all to urban areas, it certainly affects suburban and rural regions as well, I just wanted to highlight several statistics. First, in 2011, almost 2,000 Pennsylvania children under 7 were confirmed as having an elevated blood lead level. And strikingly, almost 57% of these children came from the southeastern region, with about 700 coming from Philadelphia alone. Further, the southeastern region of the state from 2003 to 2009 also had the highest percentage of children with asthma of any Pennsylvania district at 11.7%. And lastly, we wanted to note that in 2012, the Asthma and Allergy Foundation of America ranked both Philadelphia and Lancaster City among the top 100 most challenging American cities to live in for people with asthma. So this data just provides some baseline information about the unique challenges in our region and the need for comprehensive environmental services to help address these issues. So in order to do so, the National Nursing Centers Consortium and our partner agencies provide the Southeastern Pennsylvania Lead and Healthy Homes program. Our program focuses on improving environmental health in households with expecting mothers and or children where there's a child under 7. And when there is a risk for lead poisoning, this can include living in a house that was built before 1978 with chipping or peeling paint. When there is the expecting mother or child is suffering from asthma, or there are other home health hazards to be addressed, this could include pest issues or mold issues, items like that. So when a household meets that criteria, our program can provide a free home visit. It's called an environmental home assessment. During this visit, we provide participant education on how to improve the health of the home. For example, if there is a small amount of mold in the property, the Healthy Home Specialist could teach the participant how to safely clean the area and give recommendations on how to prevent future mold growth. We also provide free healthy home supplies to help address home health hazards. For instance, we give out cleaning supplies like mops and all-purpose cleaners, as well as things like storage containers, which can help reduce clutter and keep items safe from pests. We also provide some supplies specifically for asthma, like hypoallergenic mattress covers. So that is one component of our program. But in addition to providing these healthy homes assessments, our program also provides environmental inspections for children who are lead poisoned. So in our region, this is defined as having a confirmed blood level greater than or equal to 20 micrograms per deciliter, or 2 blood levels greater than or equal to 15 micrograms per deciliter taken 3 months apart. So this is the case in all of southeastern Pennsylvania except for Philadelphia, where the level needed for an environmental inspection is greater than or equal to 10 micrograms per deciliter. And during an environmental inspection, our program will test surfaces in the home to determine the presence of lead paint. We will visually identify chipping or peeling paint, and we will collect and analyze lead dust mites or soil samples. An environmental inspection report will be given to the property owner and any other relevant parties, and this will include a summary of the findings and any recommendations to remediate the lead hazards. So with these services, we very much believe that our program can help reduce home health hazards and greatly improve the health of the families that we serve. We encourage you to reach out to us to find out more and connect your patients and clients to services. Since our program serves 8 counties in the region, there are several wonderful partners helping the National Nursing Centers Consortium provide these services. If there are any overall questions at all, or if you'd like to connect on any of our services, please don't hesitate to contact me directly. My contact information is at the bottom of the slide. And just to briefly touch on how to get connected with us, in Berks, Lancaster, and Schuylkill counties, you can reach out to Pinnacle Health. For Bucks and Philadelphia counties, you can reach out to me at the National Nursing Centers Consortium. However, please do note that if there is a need for an environmental inspection for a lead-poisoned child in Philadelphia, the Philadelphia Department of Public Health can provide these services. Their contact information is included at on the slide here, along with a link that has some useful information about lead poisoning. In Chester County, you can contact the Chester County Health Department. For Delaware County, it's the City of Chester Bureau of Health, and in Montgomery County, it's the Montgomery County Health Department. So again, please don't hesitate to reach out to the National Nursing Centers Consortium or one of our great partner agencies to find out more. And thank you everyone for your time. I'll now turn it back to Dr. Paulson.
Thank you. Let me explain now, use this time to explain a little bit more about what a pediatric environmental health specialty unit is and how a pediatric environmental health specialty unit can help you. I see some of you are starting to write questions into the chat box, and we welcome that, and we will turn to those questions in a moment, so please continue to enter your questions into the chat box. So pediatric environmental health specialty units basically provide education and consultation. Anybody, pediatrician, nurse practitioner, public health official, parent, school teacher, grandparent, anybody can call us or contact us via email. We have both a toll-free phone number and an email address that I'll share with you in a moment. We will try and answer that question for them. I'm a pediatrician. I work with a toxicologist and have access to individuals with other expertise in environmental health, and all of the pediatric environmental health specialty units collaborate with each other when we are confronted with unusual circumstances that we may not have encountered on our own. this list that you see in front of you gives you some sense of the kinds of problems that we deal with, but it is not an all-inclusive list. And so if the parent or the provider or whomever thinks that something has to do with a child or children, with the environment, and with health, they can contact us and we can try and help them find information or provide information to them about the question that they have. So again, in terms of the Mid-Atlantic Center, myself, Dr. Amir Shahahi, Veronica Tinney is our coordinator, and I have a fellow working with me on a very part-time basis. We do have a toll-free phone number, and we do have an email address. We can be reached through our website. And so now let me turn to our questions, and if I need to, I will also ask Rachel to rejoin the conversation. So one question here is mold dangerous once it dries and there's no longer continuous moisture, or is all mold potentially dangerous? And yes, all mold is potentially dangerous in large quantities. I mean, the little bit of mold that all of us might have, you know, between, you know, the tiles in the bathtub, it pops up, you wash it off, it comes back again 2 weeks later. I mean, that's not the amount of mold that's likely to cause any problems, but large amounts of mold, wet or dry, can be problematic. And the mold basically can't be cleaned from surfaces unless they are non-porous surfaces like tile or stainless steel. If it's a porous surface, if it's wood, if it's wallboard, if it's some kind of fabric, if it's plaster, that material needs to be removed and replaced. It can't really be cleaned in any way. Next question is, what is the appropriate treatment for lead found in soil or ground on a home property, and in this instance from old dumping of leaded gasoline? This is a very individual situation that you need to work with your local health department in all likelihood. The remediation is removal of the contaminated soil, so somebody's got to figure out how far down the soil has to be removed, and then replacement of that with uncontaminated soil. But it's a complex process and not one that should be attempted on a do-it-yourself basis. We have someone from Virginia who wants to know about resources in Virginia, and I think the easiest thing there is if you use the email address on your screen right now, macche@childrensnational.org. That way we'll respond to you and send you information about contacts in Virginia for lead. What type of radon information is provided to clients? Not quite sure what the questioner is getting at there, but Rachel, let me turn that over to you because it may be more directed to you, as is the next question, which is how are the families chosen to participate in the home assessment program?
Okay, sure. Concerning the radon question, for our program, we give out the Help Yourself to a Healthy Home booklet, which does touch on radon. For families that are located in areas where there's a high frequency of radon, or if the family is particularly concerned, we have a more specific EPA booklet that we can give out. We also do have a limited number of free test kits that we can give to families, particularly those who are in the the areas with high radon levels. So those are the ways we address radon with our program. And I believe, Dr. Paulson, you said the next question was how are children chosen to be in the program?
Yes.
So we welcome referrals. The household either needs to have an expecting mother or a child under 7, and we prioritize households where there is either a risk for lead poisoning, an asthmatic child or expecting mother, or there are other home health hazards. And again, that can be pests or mold, substandard housing, and we welcome all referrals. I hope that answers those questions.
There's another question here about where does the PEHSU receive its referrals for children with lead levels of concern. So as I mentioned, there are 10 pediatric environmental health specialty units in the country. So depending upon where you are located in the country, you would contact your regional PEHSU. And contact information for all of the regional PEHSUs is available at www.PEHSU.net. If you are in Region 3, that is Pennsylvania, Delaware, Maryland, Virginia, West Virginia, or the District of Columbia, and you need more assistance than is provided by the local resources that Rachel mentioned, then certainly you can contact the Mid-Atlantic Center at the toll-free number or the email address, and we will coach you in the management of the children, the homes, the families, etc. We generally don't physically see the kids because we're in Washington, D.C., and we cover such a large geographic area, and we don't have any sort of special equipment here that can do things that you all can't do locally, but we certainly can coach you. I had a call yesterday from a physician who is seeing the child after the child had a documented blood level of 65 micrograms per deciliter, which certainly is extremely high for this day and age. That child was admitted to the hospital and chelated, and now the primary care physician is providing follow-up. We had a conversation before the child went home and laid out some parameters, and she had been doing her follow-up and wanted to touch base and just make sure that things were on the right track, ask a few more questions. And so she called and we chatted again yesterday, and now she's comfortable with following on in terms of the next steps, and if she needs more help, she'll call me again in a couple of weeks. So that's our preferred method of working. Some of the other PEHSUs may do it a little bit differently. Here's another question. What do you think is the most important topic to discuss or share with moms who've just had a baby to help improve their home environment? I think certainly from my perspective, given the prevalence of smoking in many communities, that still is the #1 environmental issue that needs that parents need support on. If there are people in the home, they need to be helped to quit and can be referred to quit lines or to providers who can provide medications and other interventions. And that, I think, is extremely important. In homes where there are no smokers, probably the second most important environmental health issue is actually radon. And that's because it's invisible, odorless gas, and elevated radon levels are a potential problem either in a basement or if the house is built on a slab on the first floor of the house. Usually second floor, third floor isn't a problem, and so people who live in multifamily dwellings above the ground level, it's usually not an issue for them. But long-term exposure to radon is associated with the development of lung cancer, not in childhood certainly, but 40 to 60 years later, and that risk is increased if, as the person grows up, they also start to smoke. Radon detectors, radon screening a basement or a ground level room for radon is relatively low cost. Interventions are somewhat higher cost, but when amortized over the life of a building, life of a home, not that expensive. In some areas, the local health department or Department of Environment can provide free home radon test kits. And if you go on the EPA website, www.epa.gov/radon, you'll find national level information about radon and then links to every single state radon office. And if you click on your state radon office, you can generally then find information either at the county level or sometimes as small as the zip code level from the state radon office sites. And you can get to any and all of them through the national site, www.epa.gov/radon. Another question is about screening or testing for blood lead levels, and I think that kids, particularly who live in older housing, whether that older housing is in good repair or not, should be screened at least twice during childhood, preferably somewhere around 1 year of age, when most pediatricians are also checking the blood for hemoglobin hematocrit, looking for evidence of anemia, and at around 2 years of age. If the blood levels are below the reference level, both at 1 and at 2, then unless the family moves into an extremely contaminated environment or the child has developmental disabilities that mean that the child is continuing the hand-to-mouth activity into a later age than is typical, then most kids after 2 are not going to become at risk of elevated lead levels if they're staying in the same environment, and they, as most kids do after about 2 or 3, put their hands in their mouth less and less often. So Rachel, we only have about 2 minutes left. If you want to finish up, and I will just add that for those of you who sent in questions that didn't get answered, if you want to email those questions to Mid-Atlantic Center or MACCHE@childrensnational.org, I will try and respond individually. And for those of you who want your continuing ed credits, please look at your screen right now and get this information down so that you can complete your requirements for your CEUs. And Rachel, I'll turn it back to you.
Thank you, Dr. Paulson. I just wanted to thank everybody for your time today. If you are looking to receive CEUs, the information about the post-evaluation and where you need to send an email to is on the last slide there. And thanks to the Clinical Directors Network for setting that up. And if you need to reach out to me at any time, I just posted my email address, so feel free to send me an email. Thank you again, Dr. Paulson, and have a great day, everyone.
Goodbye, all. Thank you.